they want to put me on Neurontin, which is a seizure medication, but it also helps to treat the pain with interstitial cystitis, and I can't afford that because that's high. I can't afford higher pain medications that I know that will help me because they're too expensive. So it's hard. If you don't have insurance, then you pretty much suffer even more.
Mm-hmm. So there's stress also is a factor too, that it can increase the pain and the discomfort that comes with IC, correct?
Definitely, because stress, you have stress in your normal life, so everybody has experienced some level of stress, and you know how intense stress can affect your body. So if you're suffering from an illness or a disease, or even with interstitial cystitis, if you're suffering and you're stressed, that's putting more, that's putting more emphasis on the pain and on your symptoms, and it's making it worse because you are so stressed out. So once you're stressed, you definitely go into a flare, and you definitely feel, more intense with your symptoms because you have so much going on, and you're worried, and you're scared, and you're sad, and you just have all of these things that's causing you stress, and then that stress contributes to that pain level to increase.
Wow. Whew. My heart goes out to you, Christine.
Thank you.
Because I haven't known a time when you didn't feel well based on this condition you have.
Yeah.
I mean, and you're sitting on a whoopee cushion. Right
Yeah,
now.
right now I'm sitting on a sitting pillow, and I am experiencing urethra pain right at this moment. But it's so interesting that I can still sit here and I can still act normal and I can still smile. But it's interesting. It's a good thing, but then it's sort of like a bad thing because people see that as, okay, she's not sick, So we say this interstitial cystitis is invisible because you can't see it. Like some people you can, because it does get to that point where you can't function and you can't get out of bed and you bent over in pain. But in my case, I've been suffering for this for 4 years now, and it has only progressed. My symptoms have only become worse, but I'm still able to maintain a position where I can still laugh and still smile and still talk about it and act normal. But yes, my pain level is probably about an 8 right now, and I'm not on any medications or anything to ease that pain, so I'm still just like just dealing with it.
So emotionally, spiritually, you can become depressed.
Yes.
And because this is something that you have to deal with every day.
Every single day.
So what have you, now I know that I was doing some reading, it says about diet.
Mm-hmm.
What are you doing to help yourself deal with this condition? Because it's not easy. So this has to be something you do often and frequently in order to take care of yourself. So.
Yeah, as far as diet, there is a diet regimen that we call IC diet. And this diet is particularly for interstitial cystitis, but not everything on the list applies to people. So in my case, I'm having an issue with finding things that will put me in a flare. I have some things that I know to stay clear of, but those same things I can eat or drink one day and it doesn't affect me, and then maybe another day it affects me. Like, I love orange juice. I love it, love it, love it. And sometimes it will increase my pain, and then sometimes I could drink it and it doesn't do anything to me. So mostly with people who have IC, they have to stay away from certain foods. They have to stay away from a lot of things that are acidic. They have to stay away from soda. And what frustrates me is one of the things for UTIs, they say drink cranberry juice. Cranberry juice is a big no-no for people with IC because the acid in it and the citric in it makes your symptoms worse. So we get frustrated when we hear, go drink some cranberry juice. That frustrates us. But chocolate, coffee, anything with caffeine in it, alcohol, like there's different things different foods and different beverages that we have to stay clear from. But like I said, it doesn't apply to everybody. And for me, a lot of things, I don't really, honestly, to just be honest here, I don't pay attention to the IC diet because I find that I don't have anything that affects me or that puts me in a flare. Like I said, I have, a few things, but I don't follow the IC diet. But I do encourage that anybody who is having some bladder issues, some pelvic region issues, or is suffering with IC, I do suggest that you at least look into the diet and, try to remove some things from your diet.
Now, what about, question. Okay, so diet is one thing.
Yep.
Okay, so what are some of the other things? Because I know you use heat. Do you have heat on you right now?
No, not right now. I didn't bring it today.
Okay.
But every day I have some kind of heating pad around my pelvic area or my lower back area. And sometimes I use ice packs because sometimes ice works, but it's cold. But I usually use the ice packs for my urethra pain. So to be honest here, I put it in my panties. Wow. And that kind of helps with my urethra pain, but then again it kind of backfires because it only makes my urine hot. So once I pee, then it makes the burning increase. Ooh. So it's always just like you playing tug of war. It's like you can't win from losing with this. So
interesting. So then warm baths, you said you do that. So
yeah.
Heat seems to help alleviate it. But you can't live in the bathtub. Exactly. And at some point it's not working.
Right.
So sleeping, you have issues with sleeping?
Yeah, definitely. I've always had sleeping issues even before I knew that I was diagnosed with this. But your sleeping patterns does change. I'm the type of person, I go to bed late and get up early. And for the last few days, I have been waking up like in the middle of the night, like around 2, 3 o'clock in the morning in severe pain. And I will wake up like several times and this pain is just still there. So it does interrupt your sleep. It really does. And if you don't have some kind of sleep aid to help you, then you won't get any sleep. So right now I am taking Xanax, and Xanax is specifically for anxiety, but it helps me sleep. So I don't take it during the day. If I can prevent it, I take it at night. And usually the Xanax helps me sleep. But lately, since my pain has increased, I've been waking up early in the morning in intense pain.
Wow. So through all of this, Christine, how have you maintained your sanity? How have you, sometimes I guess it's difficult.
It's very, very difficult. I guess this year has been the most trying year, but it has been the most it has brought me more positive things to look into and look forward to. Even though I'm in this intense pain every day, I found some kind of hope and encouragement and inspiration to move forward. And with this being September, this is IC Awareness Month. And out of the 4 years that I've had this, I just learned about this month last month. So I'm new to this, but I took this opportunity to take advantage and spread the word of interstitial cystitis. I've been making YouTube videos. I've been connecting with the IC forums on Facebook and support groups on Facebook, and I've met all these people who suffer from interstitial cystitis on Facebook, and I'm learning all these things about people. And that's what keeps me sane, because I really don't know. Sometimes I see that somebody has it worse than me. And I used to hate that phrase that, somebody always have it worse than you. But for me, it's like, you say that, but that doesn't take away you know, my pain. That doesn't, you know, take anything away from that. But it does make you grateful and thankful for your situation. Yes, I'm not in a good position, but I'm grateful that I'm still able to walk. I'm grateful that I'm not bedbound. I'm grateful that I'm not in the hospital. I'm grateful for these things. Yes, this pain is killing me, but I'm grateful that I'm still living and I'm able to breathe and I'm still able to push and go to the doctors and, you know, try to find something that will help ease my symptoms and try to get on the right medications. And, you know, I don't have the resources that I need right now, but yes, I'm still up and fighting to find whatever I can to help myself, because that's a big issue, you know, with me being on the support groups and things like that. A lot of people, I don't want to say complain, but I hear them always, you know, talk about that we don't have enough help and, you know, the doctors can't figure this out or that out, but we're always looking on the outside. And I just want to encourage people to, it's time to look on the inside. It's time to look within yourself and see what you can do to do more and get the awareness out there and do more to help yourself, because that's where the true health is going to come from. If you keep looking for the outside, you're going to continue to be disappointed. So once you look within the inside and say, okay, what can I do to change my situation? What can I do to make my day better? What can I do to, you know, ease my pain? Once you do that, a bunch of doors will open. Like yesterday, I was so frustrated. I was literally angry and frustrated at this disease. But Eunice gave me the opportunity to come and talk about it. And this is the first time that I've ever been live on the radio. This is the first time I've ever really, you know, spoken out about this. So I was so grateful and humbled to take this opportunity and say, this is something huge. It might not get me to where I need to go, but it's a step. It's a step towards the right direction. You know, a lot of people are scared. They're scared because they're scared that no one will take them seriously, will believe them. You know, they're scared. And it's time to let go of the fear, because fear robs you. And fear has robbed me for so long that I can't do it anymore. Like, if I continue to be fearful and afraid, then I will never get the help that I need. So I want to take a stand, because this is not well known. A lot of people don't know what this is, and I'm pretty sure as I'm talking about it now and people are listening in, they're probably thinking in their minds, I've never heard of this. So I'm taking a stand to get it out there, because like you said, there's cancer, there's diabetes, there's all these different things that are well known and are publicized, but ours isn't. And I feel like ours is just as a big of an issue as cancer. And it really upsets me that, you know, we don't have that what we need. We don't have what we need. So, but yeah, it's been a journey. It's been a rough journey, and I don't know anyone in the Champaign community area that suffers from IC, and there aren't any support groups that I can go to